In this constantly changing world, 10.8 million individuals were affected by tuberculosis in 2023, representing a 9.3% increase in newly diagnosed cases compared to 2022. The number of people living with HIV reached 39.9 million in 2023, a significant rise from 32.2 million in 2013. Malaria cases continue to rise, and the global tally of cases stood at 263 million in 2023, with an increase of 11 million cases from year 2022. Additionally, the COVID-19 pandemic claimed 6 million lives worldwide. 45% of deaths among children under 5 years old are attributed to undernutrition. 1.4 billion people are suffering from disabilities caused due to non-communicable diseases in 2023, an increase from 70% in 2013 to 80% of total disabilities in 2023.
While the developing nations are still struggling with infectious diseases, NCD burden continue to rise. All of these disturbing numbers are on rise due to the suboptimal functioning of health system. For strengthening health system, World Health Organization has given 6 building blocks, where the leadership and governance building block cuts across all the sectors of healthcare. Leadership training among healthcare workers helps them to work efficiently in finite resource setting. The management of COVID-19 pandemic across the world has shown us that healthcare professionals were not well trained in managing the crisis. Countries with good leadership and governance fared well during the COVID times. The existing trainings are theoretical, not contextual to LMIC, and have a huge cost. Thus, a need for leadership and management training for healthcare workers was established.
Looking at the need of public health management and leadership, I conceptualized this International Public Health Management Development Program way back in 2016. Initially, it was a challenge for me because people were not aware about the importance of leadership in public health. But I took this as a challenge, and then we initiated this International Public Health Management Development Program, which was a huge success.
The program was established with the objective to enable the participants to build capacity of middle and senior managers in designing, implementing, monitoring, and evaluating program and project operations, and to equip participants on appreciating gaps in the current scenarios and envisioning future trends in healthcare management for effective decision-making. Our call for the first course in 2016 received a great response, even though it was self-sponsored by the participants themselves. 100+ nominations were received, and we selected 36 participants from 15 states of India, which included 5 head of department from leading institute AIMS. One of the alumni of the first course was selected as a Director of Cultural Relations in Peru. He went there and convinced the ambassador of India in Peru to conduct a similar course in Peru, but it had to be conducted in Spanish. And with the call, the program got an international platform in 2017. Consequently, a flagship program of the Ministry of External Affairs and International Technical Economic Cooperation was set up. Therefore, IPHMDP established a second milestone. Officials from the Ministry of External Affairs approached us to involve the senior level or policy level managers, so that middle level managers trained under IPHMDP shall work harmoniously with senior level or policy level managers to fortify the health system. Subsequently, a course in public health policy and management was added to strengthen the senior cadre. Hence, third milestone in the journey of IPHMDP was laid down. These are the few glimpses of IPHMDP courses over the years. Observing the best practices of the international delegates, we realized that an exposure to international practices to strengthen the Indian health system is needed. Following that, we engaged with the National Health Mission of various states and proposed the idea of conducting a course for senior policymakers and program implementers, where they can learn good health system strengthening practices from neighboring countries and replicate them in their jurisdiction and states. where they could learn valuable best practices from neighboring countries that have developed unique and replicable public health approaches. This idea led to the creation of an executive leadership program for NHM officials. Even during COVID-19, when everything stood still, our learning remained uninterrupted as we launched online program under the broader umbrella of IPHMDP. This marked a significant milestone for International Program for Health Management and Leadership Development Program, IPHMDP, as we ventured into the realm of online education for public health. In response to a request from the Ministry of External Affairs, we expanded our online course offerings to include diverse domains of public health management, allowing public health management professionals to enhance their knowledge in areas such as supply chain management, health system strengthening, and quality management. Besides weekly courses, we have launched courses for the duration of 3 months and 6 months.
With our program's expanding reach, spanning over 96 countries in less than 9 years of inception, the demand for country-specific courses from our alumni continued to grow, leading to the 6th phase of the International Program for Health Management and Leadership Development Program, IPHMDP. Recognizing the importance of these courses, ITC, Ministry of External Affairs, approached PGIMER, Chandigarh, to design a special course that goes beyond clinical skills for nurses. As nurses are the first to arrive and often the last to leave, as they are the backbone of every hospital, keeping this in mind, a transformative journey tailored to enhance the managerial capabilities of nurses, the Nursing Leadership and Management Program was developed in 2024. Here are the glimpses.
It is a matter of pleasure for me to be a part of this program because I learned a lot in this regarding the management and leadership skills. Apart from the clinical skills or the clinical implementation of our knowledge that we have been doing, I think I'll be able to implement the leadership and management skills in my day-to-day management of my practice as well as the practice of my organization. To sum up, I learned to do the right things in a right way. Thank you.
This program is unique. It builds capacity. It make you a better leader. So I want you to be involved with it. Speak to your government also to talk or partner with the Indian government so that you can acquire the knowledge we have gained in a short period of time.
I would like to thank the government of India, ITEC, and the Ministry of External Affairs to prepare such very lovely training opportunity to share the experience, especially the international public health management.
There was also a lot of learning to do through games, and also we had some time to visit India through the field visits, and part of the field visits exposed a lot of things that we are not yet doing in our continent.
These kind of training programs are valuable for us because they have a certain methodology. The gamification is a method that is not often found in training programs, and lectures, content, and approach to the topics is very on point, very precise, and very useful.
The methodology that you are using, I find it very practical and very easy to follow, and very fun as well. We don't feel like we are really in a training, like it's a combination of learning, interacting with other participants.
We do have long days, but the days go by so quickly because it is filled with fun, a lot of interaction, there is gamification, and so we learn in a way that is very tangible, very practical. It is a learning mechanism that I think should be copied and repeated, and I hope that those who are here with me today from 19 countries, that we can continue to remain in touch. The networking has already started.
IPHMDP's use of gamification is simple, brilliant, and has been a game changer in my career. I can recommend IPHMDP's gamified courses enough. Thank you very much.
IPHMDP's adult teaching pedagogy is truly exceptional. The innovative approach blends experiential learning, practical application, and personalized mentorship, creating a transformative educational experience.
Visionary, splendid,
teamwork,
interactive,
interesting, magical,
effective,
effective,
motivation.
These courses are designed to address the need and demand and specific health system-related challenges faced by different countries, fosters the development of marketing abilities, strengthens collaborative network for cross-functional projects, effectively address future challenges within their organization through best practices and innovative strategies. The target audience for this group are doctor, nurses, middle-level managers, senior policymakers, public health professionals.
The impact of our IPHMDP program has expanded to more than 96 countries, resulting in the formation of a global IPHMDP community consisting of over 1,400 participants and a resource faculty alumni group of 100 plus. Additionally, we have successfully trained 620 participants through our online platform.
International Public Health Management Development Program stands out in developing leadership and management skills in senior level managers across the globe. It has a unique pedagogy of learning with fun. We use gamification approach to enhance learning of senior managers. This not only inculcates interest among global audience, but also it is immensely useful for improving the sustainable development goals and increasing universal health coverage across country, which will help in strengthening health system of developing nations across the globe.
As IPHMDP continues to groom visionary leaders and nurtures the potential of aspiring changemakers, we pave the way for a brighter tomorrow, where a new generation of public health leaders will shape the future of global well-being. IPHMDP Building Future Leaders.